Welcome to the Type 2 Diabetes and Bariatric Surgery class. My name is Noreen. I am a nurse practitioner with a passion to help those living with diabetes optimize their health. In the bariatric surgery program, we see many people with type 2 diabetes. This class will review 6 common questions related to diabetes. Please consider writing down any questions you'd like to ask your healthcare team. We hope this class will increase your knowledge, answer questions you may have related to diabetes and bariatric surgery, and help you reduce diabetes-related health complications. Okay, let's start with the first question. How will healthy blood sugars help me? Let's start with learning the medical term for sugar. It is glucose. During this presentation, if you see the term glucose, remember it means sugar. Healthy blood sugars can help decrease infections, decrease hospital stay, improve wound healing, improve energy levels, and improve your long-term health. Maintaining healthy blood sugar levels reduces your risk of diabetes-related complications. Most complications take years to develop. Although they might seem to be in the distant future, or far off in the horizon, so to speak, they are tricky. Some people can have abnormal blood sugar levels for years before they receive a diagnosis of diabetes. Many times complications start developing way before you feel or show any symptoms. These diabetes complications include stroke, loss of vision, heart attack, digestive problems, loss of kidney function, sexual dysfunction, amputations, and nerve pain. Great news! Research shows that healthy blood sugars can help prevent or minimize complications. In a few slides, we'll show you by how much. Now on to question 2. How will I know if I have healthy blood sugars? You'll know by measuring. One way to measure is a lab test called A1C or hemoglobin A1C. For most people, the goal or target result is 7% or less. Home blood sugar monitoring is another way to measure. The goal or target for blood sugars when fasting or before a meal is 4 to 7 millimoles per liter, or simply 4 to 7. Naturally, when we eat, our blood sugars rise. The goal or target for blood sugars 2 hours after a meal is 5 to 10 millimoles per liter, or simply 5 to 10. The A1C blood test measures long-term blood sugar levels. It gives you a blood sugar average over the past 3 months. Higher readings for longer periods of time are related to increased risk of diabetes complications. A1C readings closer to 7% are related to less complications. Another way to measure is home blood sugar or glucose monitoring. This measures current glucose levels, meaning what your blood sugar is right at the time of the test. It involves finger pokes or glucose sensors. This type of test is not needed for everyone with type 2 diabetes. Check with your healthcare provider to see if this is recommended for you. Here's the great news I promised. Research shows that for every 1% drop in A1C, The risk of diabetes complications drops by 35%. This is fantastic. For the third question, how can I get and keep blood sugars in a healthy range? There are several ways. Some people may only need a few of these to attain healthy blood sugar levels. Some need all of these, plus bariatric surgery. Diabetes tends to progress with aging, so over time, people may need more assistance to keep blood sugars in a healthy range. Here are the 5 main ways to manage blood sugar. The first 4 are very important as they help you attain a lifetime of overall wellness. Healthy eating, regular physical activity, healthy body weight. Bariatric surgery is a tool that could help you attain a healthier weight. Stress management, and medications as needed. Healthy food choices and eating habits may slow glucose absorption, decrease hunger, lower A1C, lower cholesterol and blood pressure, help with weight loss, and improve overall health. At the end of this video, I will share with you how to find resources for healthy eating. Remember, it is important to eat a variety of foods, especially vegetables and fruit. Enjoy low glycemic and high fiber foods. Spread food over the day with reasonable portions each time. Healthy eating after bariatric surgery has specific guidelines. Your dietitian will help you with these. Regular physical activity and a healthier weight can both help in similar ways. They help your body's insulin work better, lowering blood sugars, help lower cholesterol and blood pressure levels, improve mood, reduces your risk of many health conditions, and improves overall well-being. I'll show you how to find resources for physical activity at the end of this video. A great place to start is a 5 to 10 minute gentle stretching routine daily. Once that has become a habit, add other activities. If you are not currently physically active, think move more and sit less. Find a variety of things you like to do. Walking and sit and be fit classes are excellent choices. Consider how you can increase your physical activity with the common things you do daily. For example, when brushing your teeth, can you walk in place? Or when watching TV, use the commercial breaks for physical activity, like arm exercises or get up and walk. Remember to have fun. Biking, swimming, and boxing can be great fun. Start slow and work your way up to 30 minutes 5 days per week. You can also divide the 30 minutes into 3 10-minute sessions. Diabetes Canada recommends the addition of resistance exercises 2 to 3 times per week. Resistance exercises can be done with your own body weight. An example is push-ups, or using free weights, gym exercise machines, or resistance bands. Research shows that resistance exercises not only lowers blood sugars, but also is helpful in maintaining weight loss. Diabetes Canada has a handout that describes resistance exercises and provides examples that you can do from the comfort of your own home. The examples provided can be done sitting or standing next to a chair. A link to the Diabetes Canada resource can be found at the end of this video. Stress management is very important for many aspects of your health. It can reduce glucose made by the liver, lower blood sugars, reduce stress eating and drinking, improve well-being, reduce the risk for heart disease and stroke, increase smiling, laughing, and much more. There is a whole bariatric surgery learning module dedicated to this topic. Medications can help you maintain healthy glucose levels. Remember, that's the medical term for blood sugar. There are a variety of medications that work in different ways. They can reduce glucose made by the liver, slow the absorption of glucose from the gut, decrease appetite, reduce weight, help insulin work better, help the body make more insulin, provide more insulin with insulin injections. Some can even help improve the health of your heart and kidneys. So the great news is there are many ways to lower your blood sugars. Now on to question number 4. Well, really question 4A and B, as the answer addresses two questions. Can I stop my diabetes medications after bariatric surgery? Will my diabetes go away after bariatric surgery? Bariatric surgery can reduce blood sugar levels, reduce diabetes medication, and lead to remission of diabetes. Medications after bariatric surgery. This can vary from person to person. Some people can stop medications right away after surgery. Some people can lower types and doses slowly with weight loss. There are safety concerns with some medications after bariatric surgery. We'll go over this under the safety section later on. Home glucose monitoring. Home glucose readings may help you and your healthcare team decide on medication changes after surgery. Talk with your healthcare team to learn if home glucose monitoring is important for your care. Blood sugars can normalize after bariatric surgery. The medical term for this is remission. You and your healthcare team will know if you've gone into remission if after stopping all diabetes medications, your A1C is less than 6.5%. Type 2 diabetes can advance with simple aging, so the length of remission varies from person to person. Maintaining a healthy weight, diet, and keeping up with physical activity can help keep you in remission longer. If you go into remission, it is important to check the A1C with your yearly post-bariatric surgery lab work to ensure your blood sugars are remaining at healthy levels. It is important to understand diabetes medications are important tools to manage blood sugars and prevent complications of diabetes. Please keep this in mind if your remission ends and you need to restart medications to keep you healthy. Question number 5. Are there any safety items I need to know? There are two things to mention. There is a certain category of medication that should not be used immediately after surgery, in general for about 6 months. They are called GLP-1 inhibitor medications, and the way you treat a low blood sugar may need to be altered. GLP-1 medications should not be used right after surgery due to their side effects. We have listed for you both the generic and trade names so you can identify if you are taking one of these medications. Many people know them by their trade names: Trulicity, Bydureon, Byetta, Victoza, Adlizin, Ozempic, Rybelsus. Please check your medications to see if you are taking one of these. GLP-1 side effects include indigestion, reflux, burping, decreased appetite, nausea, vomiting, constipation, diarrhea. People can experience these same symptoms after bariatric surgery. You need to get used to your new digestive system without medication side effects. GLP-1 medications are usually not restarted until about 6 months after surgery. After bariatric surgery, how you treat a low blood sugar may need to change. Treatment is still 15 grams of quick-acting sugar. Please review the Diabetes Canada handout on low blood sugar treatment. There is a link to this at the end of the video. After surgery, you will not be able to quickly drink fluids or the volume of fluid needed to raise your blood sugar. So if your current treatment of choice is juice, sugar dissolved in water, or pop, this will need to change. Pop is also not recommended after bariatric surgery due to the carbonation. We suggest chewing tablets or candy. For example, 4 Dex-4 glucose tablets, 6 Lifesavers, or 2 small rolls of rocket candy. Please remember, your healthcare team is there to help with questions about safety, medications, or low blood sugars. Take any question you have to your healthcare team. And the final question, where can I learn more? Diabetes Canada is a great place to learn more. Here you will find handouts and information on diet, low blood sugar treatment, and physical activity to include the resistance exercises I was talking about earlier. You can type in the website address or hold your phone over the QR code on the right. Alberta Health Services has nutrition education materials. Here's where you can find them. The Alberta Healthy Living Program has classes on nutrition, better choices and better health, and supervised exercise classes. The Set Yourself Up for Success learning modules are also a great resource for many of the things we discussed here today. The site where these are kept may change, so if you don't find them here, please ask your bariatric surgery team member where to find them. Thank you for taking the time to learn how to optimize your health when living with diabetes.